Okay, so section 6D is going to be about your adult and pediatric seizures. Pretty short protocol here, pretty self-explanatory. The treatment priorities: vital signs O2, dextrose for hypoglycemia, or benzodiazepine for sustained active seizures. So main thing is when we get on scene, we want to figure out if they have a history of seizures. Do they take medication such as like Keppra or anything like that for seizures? Did they fall and hit their head and have a seizure? Is the seizure caused by trauma? What is causing the seizure? Is it a history? Is it trauma? Or is it just something new? So that's the big thing with seizures that we're going to talk about. As far as your EMD all the way through advanced, you're going to treat this just as you would treat your altered mental status, because you're not going to be able to give give a benzodiazepine until a paramedic arrives. So you're going to treat this exactly like your altered mental status. For paramedics, when you get on scene, you're going to evaluate for other altered mental status etiologies and treat per appropriate protocols. If this patient is having a seizure when you arrive on scene, our first line medication is going to be midazolam, also known as Versed, 0.1 milligrams per kilogram IM IV IO push to a max of 5 for an active seizure. You can repeat this once in 5 minutes if the patient is still seizing. If for whatever reason we do not have Versed, then our second line medication will be diazepam, which is the exact same. It's not the exact same dose. It's just the same as far as when you repeat it in one time in 5 minutes. Your dose for diazepam is going to be 5 milligrams IV IO push or 10 milligrams IM. So keep that in mind. Your Versed is going to be 0.1 IM IV IO to a max of 5. Your diazepam is going to be 5 milligrams IV IO push or 10 milligrams IM if the midazolam is not available. If that is not available, then we could also give lorazepam, which is going to be 2 milligrams IV IO IM for active seizure, and then you can repeat that one once in 10 minutes. So just to clarify, for adult active seizing patient, you've got Versed, 1 milligram per kilogram, max of 5, can repeat once in 5 minutes. For diazepam, it's going to be 5 milligrams IV or IO or 10 milligrams IM, and you can repeat that once in 5 minutes. For lorazepam, 2 milligrams IV IO IM, and you can repeat that once in 10 minutes if the active seizures still exist. For pediatrics, for Versed, it's going to be 0.1 milligrams per kilogram, max of 5, repeat once in 5 minutes. For pediatrics, for diazepam, it's 0.1 mg per kg, max of 5, repeat once in 5 minutes. Or your lorazepam, 0.1 mg per kg, max of 2, repeat once in 10 minutes. Online medical consult if seizure continues despite above treatment, continuous assessment and treatment per applicable protocols. So the big thing with seizures is just to put them in a position where they're not going to hurt themselves. Try to remove anything that can potentially hurt yourself or the patient around the patient, because they have no idea what's going on. They're having all that electrical disconnect in their brain, and that's they're having that seizure-like activity. When a patient comes out of their seizure, they go into what is called a postictal state, and the fastest way to get them out of that postictal state is going to be oxygen. So just keep that in mind. If you arrive on scene and they said the patient had a seizure and they're out of it and they appear to be in that postictal state, go ahead and put them on some oxygen, because their brain is resetting, so they need that oxygen to kind of enhance that or speed up that process, I guess would be the best way to say it. So keep that in mind. That's pretty much it for seizures. Just don't let anything around them hurt themselves. They might bite their tongue or do something like that, so just keep, if you see blood in their mouth, try to figure out what that's coming from, and then figure out, again, if they have a history of seizures, or if this is something new, or if it's caused by trauma. Obviously, if it's caused by trauma, we're probably going to treat this a little bit differently as far as where we take this patient. So try to figure out why they had the seizure, when they had the seizure. One other thing to note is how many seizures did they have? Was the seizure witnessed? Did they have 1 seizure, 2 seizures, 3 seizures, and how long did each seizure last? These are just things that the physicians or nurses will ask you once you transport this patient to the hospital.